All right, psychology students, let's get real for a sec. Remember that feeling of conquering a mountain of knowledge, like you're finally on top of everything.
I do.
But what if I told you that mountain is actually a volcano and it's about to erupt with even more information?
That's a pretty accurate way to describe healthcare, especially if you're going into psychology. It's a field that never stands still.
Exactly. Today we're diving deep into prepping for those psychology exams.
Okay.
With a twist.
Okay.
Think major healthcare system trends,
Right.
lifelong learning, and how they'll impact you as future psychologists.
Okay.
We'll be using your textbook, Harun Mitchell's Introduction to Healthcare,
Right.
pulling from both the 5th and 6th editions,
Gotcha.
as well as those tricky study questions designed to make you really think.
Yeah, it's not just about passing an exam.
Right.
It's about understanding the forces shaping the future of your careers.
Okay, let's kick things off by traveling back in time. Imagine a world where illness was blamed on evil spirits.
It might seem strange to us now,
Yeah.
but for early civilizations, that was the reality. Disease was often seen as a punishment from the gods.
Then along came Hippocrates in ancient Greece, often called the father of medicine,
Yeah.
who said, hold on, maybe it's not the gods, maybe it's something else.
His emphasis on observation and natural causes was a major shift.
Yeah.
Hippocrates really laid the groundwork for the scientific approach we use in medicine today.
And that approach was put to the test during the Middle Ages,
Right.
when the bubonic plague swept across Europe,
Devastating.
devastating. But it also led to the introduction of quarantine.
Quarantine was a way to contain the spread of disease. And as we've seen in recent times,
Oh, yeah.
it's still a relevant public health strategy.
Yeah, so
Sure.
true.
Yeah.
Fast forward to the Renaissance,
Okay.
a period of incredible intellectual and artistic growth.
Right.
This is when we see the printing press come into play, making information more widely available, and detailed anatomical drawings start to change how we understood the human body.
But even with those advancements, sanitation remained a huge issue.
Of course.
And diseases spread easily. Imagine the streets back then, overflowing with waste.
Yeah,
It's not a pleasant picture.
not at all.
No.
Thankfully, things started to change in the 17th century.
Okay.
This is when a tiny invention had a huge impact to microscope.
It's amazing to think how something so small revolutionized our understanding of disease.
It really is.
Suddenly, we could see the microscopic organisms that caused illness.
And this is where your future career really starts to take shape.
Okay.
As the microscope revealed the intricacies of the human body, the study of the brain and psychology gained momentum.
The 18th century brought even more advancements.
Right.
The concept of mental illness as a disease, not demonic possession,
Right.
began to take hold.
We finally started to understand the importance of sanitation. And Edward Jenner developed the first vaccine, changing the course of human history.
Then came the 19th century,
Okay.
an era marked by significant progress in medicine. Nursing blossomed as a profession,
Yeah.
and specialization started to emerge.
Think about the impact of Louis Pasteur's work on germ theory,
Huge.
led to Joseph Lisser's antiseptic techniques, making surgery much safer.
The 20th century brought a wave of groundbreaking discoveries,
Yeah.
blood groups, vitamins, the development of synthetic drugs. It was a period of incredible progress.
The invention of the computer revolutionized diagnostics and treatment.
Wow.
Organ transplants became a reality,
Right.
and we started grappling with complex ethical dilemmas,
Right.
from living wills to physician-assisted suicide.
Heavy stuff.
It was a whirlwind of progress and challenges,
And that brings us to the 21st century.
where the pace of change is only accelerating.
We're seeing potential HIV vaccines,
Hmm.
gene therapy breakthroughs, even the possibility of extending lifespans to 100+ years.
It's an exciting time to be in healthcare,
It is.
but it's also a time of unprecedented challenges.
Absolutely.
We've made incredible strides,
Yeah.
but there are still major issues we need to address,
Like what?
from rising healthcare costs
A big one.
to ensuring equitable access to care.
So let's unpack some of these challenges.
Okay.
Starting with one that's transforming the very landscape of healthcare
Right.
specialization.
While it's led to incredible advancements in treatment.
It's also created some unintended consequences.
Like?
Think about it with more and more specialized fields. Care can become Fragmented.
Fragmented, how so?
A patient might see multiple specialists,
Okay.
each focusing on a specific part of their health.
So who's coordinating all these different treatments?
That's the question.
Yeah.
Who's looking at the patient as a whole person?
Right.
That's a critical question.
It is.
And it highlights a major challenge in modern healthcare,
Oh.
ensuring seamless and coordinated care.
Especially as the population ages.
Which brings us to the silver tsunami.
Okay.
The term used to describe the aging of the baby boomer generation, the largest generation in U.S. history.
As this generation enters its period of heaviest healthcare use, it's putting a strain on resources
For sure.
and raising concerns about the availability and affordability of long-term care.
And speaking of affordability,
Healthcare costs are skyrocketing.
growing at a rate that's simply unsustainable.
It's a complex issue with no easy answers.
We need to find ways to provide high-quality care without bankrupting individuals, families, and the entire healthcare system.
But it's not just about managing costs.
Right.
We also need to shift our focus from simply treating illness to promoting wellness and preventive care.
It's about empowering people to take control of their health,
Yeah.
understanding that their lifestyle choices can significantly impact their overall well-being.
And this is where psychology comes in, helping people adopt healthy habits, manage stress, and build resilience. These are all crucial components of a holistic approach to health.
Take Margaret Newman's theory of expanding consciousness, for example.
Yeah.
It's not about focusing on limitations, it's about exploring possibilities,
Interesting.
even for those with chronic conditions.
It's about helping people live their best lives regardless of their health challenges.
Exactly.
And that's where the connection between mind and body becomes so important.
Except think about the psychosomatic connection.
Okay.
How stress and emotional turmoil can manifest as physical symptoms.
So it's not just about treating the physical body.
Right.
It's about addressing the mental and emotional well-being of the patient as well.
And that requires a more integrated approach to healthcare, one that considers the whole person, not just their symptoms.
Okay, let's dive into the different approaches to healthcare that patients might encounter.
Right.
We have Western medicine, the dominant model in many countries.
Western medicine is based on scientific principles, with a focus on diagnosing and treating disease through interventions like drugs and surgery.
Right. It's what many people think of as conventional medicine.
But alongside Western medicine, we also see complementary and alternative approaches.
So complementary medicine refers to practices used in conjunction with Western medicine,
That's right.
like acupuncture or massage, to enhance well-being.
And alternative medicine is used in place of Western medicine,
Okay.
encompassing approaches like homeopathy or traditional Chinese medicine.
Then there's integrative medicine, which attempts to blend the best of all worlds, combining conventional, complementary, and alternative approaches to create a truly personalized approach.
What's fascinating is that almost 40% of Americans use some form of complementary medicine.
Really? That's interesting.
It highlights the growing interest in holistic and patient-centered approaches to health.
And this brings us to a key skill for any aspiring psychologist:
Okay,
lifelong learning.
big one.
The healthcare landscape is constantly changing, with new research treatments and technologies emerging all the time.
Graduation is just the beginning of your learning journey. To
Right.
stay relevant and provide the best possible care, you need to be committed to continuous learning.
Think about CEU's professional organizations, self-directed learning. These are all tools to help you stay ahead of the curve.
It's about recognizing that knowledge can quickly become outdated, especially in healthcare.
Right.
To remain competent, you need to embrace lifelong learning as an integral part of your professional development.
So as psychology students, how can you prepare for a career in this ever-changing healthcare landscape?
Okay.
Let's explore some specific strategies for staying on top of things.
A great starting point is professional organizations like the American Psychological Association or specialized divisions within psychology.
They offer a wealth of resources,
They do.
from continuing education opportunities to conferences and workshops designed to keep you informed about the latest developments in your field.
And don't underestimate the power of networking.
Oh, yeah.
Connecting with other professionals at conferences or engaging in online discussions can expose you to different perspectives and spark new ideas.
Networking is so valuable.
It's like having a built-in support system of colleagues who are all on this learning journey together.
Now let's talk about CEUs. Those continuing education units that many professions, including psychology,
Right.
require for license renewal.
You can obtain CEUs through various avenues like workshops, home study packets, online courses, or even traditional classroom settings.
The key is to choose CEU courses that align with your professional goals,
Exactly.
address areas where you might need to brush up, and are offered by reputable providers.
And of course, there's self-directed learning.
Yeah.
This is where you take charge of your own education, going beyond required coursework.
Observe seasoned colleagues, ask them insightful questions. Delve into books and journal articles that pique your interest.
Yes.
And join study groups to learn collaboratively.
And don't forget about the vast amount of information available online.
Oh, of course.
But be discerning about your sources.
Right.
Not all websites are created equal.
True.
Look for reputable organizations, peer-reviewed journals, and information grounded in evidence-based research.
Another great strategy is finding a mentor. Someone further along in their career who can offer guidance and support based on their experience.
A mentor can help you navigate the challenges of the field,
Yeah.
provide valuable insights, and open doors to new opportunities that you might not have been aware of.
Remember, in healthcare, learning is a continuous journey, not a destination.
It's about embracing a growth mindset, staying curious, and constantly striving to expand your knowledge and skills throughout your career.
Now let's shift our focus to some of the pressing challenges facing healthcare today.
Okay.
Challenges that you as future psychologists will need to grapple with.
First and foremost, we have the issue of accessibility and affordability,
Right.
a major concern in many countries. While policies like the Affordable Care Act have made strides.
There's still a long way to go.
Yes.
The cost of healthcare remains a major barrier for many,
Yeah.
and access is often unequally distributed.
This is where the concept of social determinants of health comes into play.
Okay.
Your zip code, your socioeconomic status, the environment you live in, these factors can have a greater impact on your health than your genetic code.
Poverty, homelessness, lack of access to healthy food, exposure to environmental toxins, discrimination.
Right.
These social determinants contribute to significant health disparities.
As psychologists, you'll be on the front lines of addressing these disparities.
Okay.
You'll be advocating for policies that promote health equity and working to ensure that everyone, regardless of their background, has a fair chance at a healthy life.
Another challenge is maintaining quality care while navigating a complex and often financially strained healthcare system.
It's a delicate balance.
Yeah.
Cutting costs shouldn't come at the expense of quality. And we need to be mindful of the influence of insurance companies on healthcare decisions.
And then there's the looming crisis of Alzheimer's disease.
Yeah.
A devastating condition that's the 7th leading cause of death in the U.S.
The cost of caring for Alzheimer's patients is staggering. And with the aging population, the strain on the healthcare system will only intensify.
Some experts even predict that it could potentially bankrupt Medicare.
This emphasizes the urgent need for research into prevention and treatment for Alzheimer's and other forms of dementia.
Then there are public health priorities that demand our attention,
Such as
like preventing antibiotic resistance.
Which happens when bacteria evolve and become resistant to the drugs that once effectively killed them.
Right.
It's a serious threat, driven by the overuse and misuse of antibiotics,
We also need to tackle the opioid crisis.
which has tragically claimed far too many lives.
It's heartbreaking.
Effective strategies are being implemented to combat this crisis, but it requires a multifaceted approach, encompassing prevention, treatment, and harm reduction efforts.
And we can't ignore the alarming rise in suicide rates,
A major public health concern.
particularly among young people.
The CDC has outlined warning signs of potential suicide,
Right.
and it's essential for healthcare professionals to be trained to recognize and address these signs, providing appropriate support and interventions.
Another important issue, particularly relevant for future psychologists who may prescribe medications,
Yes.
is the prevalence of direct-to-consumer prescription drug ads.
Those ads you see on television and magazines online, they can be problematic.
Many healthcare providers believe these ads often present misleading or incomplete information,
Yeah.
emphasizing benefits while downplaying risks and side effects.
They can also lead to patients demanding medications they don't necessarily need,
Wow.
putting pressure on doctors and potentially contributing to unnecessary healthcare expenses.
So we've covered a lot of ground here, from the history of healthcare to the complex challenges we face today.
But now, let's dive deeper into the different types of healthcare facilities and services, which will give you a better understanding of where your future career in psychology might take you.
Let's start with hospitals,
Okay.
the traditional setting for treating those who are acutely ill or injured.
Most hospitals in the U.S. are accredited by the Joint Commission, a requirement for Medicare reimbursement,
Okay.
ensuring they meet certain quality standards.
Within these hospitals, you'll find various levels of care,
Yeah.
including intensive care units for critically ill patients, emergency departments for immediate care, and surgical units for those requiring surgical interventions.
Hospitals face the constant challenge of balancing high-quality care with managing costs,
That makes sense.
a complex equation with many variables,
Then there are ambulatory services
also known as outpatient services.
for patients who don't require hospitalization
Right.
but still need medical attention.
Think doctors' offices, clinics, urgent care centers.
Mm-hmm.
Even many surgeries are now performed on an outpatient basis.
This shift toward outpatient care is driven by several factors,
Yeah.
including advancements in technology cost considerations and patient preferences for receiving care in less intensive settings.
Another critical sector is long-term care facilities,
Okay.
designed for individuals who can't live independently but don't require acute hospitalization.
This includes nursing homes, assisted living facilities, and specialized care centers for people with dementia.
It's one of the fastest-growing areas of healthcare,
Really?
with a rising need for skilled professionals like nurses, therapists, and aides.
And with the aging population, the demand for these services is only going to increase.
Now, let's not overlook home healthcare,
Okay.
which brings medical care directly to the patient's residence.
It's becoming more common as people are discharged from hospitals sooner and prefer to recover in the familiar comfort of their homes.
Nurses, therapists, and home health aides are all integral to this growing field, providing a wide range of services from wound care to medication management right in the patient's home.
And then we have hospice care, which provides comfort and support for patients nearing the end of life, as well as their families.
It's a compassionate and holistic approach
Right?
that prioritizes pain management, emotional support, and spiritual care.
Hospice care can be provided in various settings,
Yes.
including the patient's home, a specialized hospice facility, or even a hospital, depending on the individual's needs and preferences.
Now, shifting gears a bit, let's explore a trend shaping healthcare delivery:
Okay.
consolidation.
This is when healthcare facilities merge under single ownership,
All right.
often with the goal of controlling costs and improving efficiency.
It allows them to buy supplies in bulk, share expensive equipment, and consolidate services to avoid unnecessary duplication.
However, consolidation also has its downsides.
It does.
It can reduce competition, potentially leading to higher prices and fewer choices for patients.
Alongside these traditional healthcare settings, new models of care are emerging.
Like what?
Retail pharmacies are expanding their services,
Okay.
offering immunizations, mini clinics, and even some basic healthcare screenings.
Interesting.
It's becoming more convenient for people to access certain healthcare services,
And then we have the rise of telehealth platforms.
allowing patients to access non-emergency medical services remotely using technology like video conferencing.
This has been particularly beneficial for people in rural areas with limited access to specialists or those with mobility issues.
We're even seeing the emergence of medical malls,
Medical malls.
where various healthcare services are conveniently located together in one space.
Like a one-stop shop for healthcare.
Exactly.
That's pretty cool.
It creates a one-stop shop for patients, making it easier to access a range of providers and services in a centralized location.
Finally, let's acknowledge the crucial role that government agencies play in the healthcare system.
At the federal level, we have agencies like the National Institutes of Health,
Okay, the NIH,
conducting research, the Centers for Disease Control and Prevention,
the CDC,
focusing on public health and disease prevention, and the Food and Drug Administration,
the FDA.
responsible for regulating food and drug safety.
These agencies play vital roles in protecting public health,
Yes.
ensuring the safety of our food and medications, and funding essential healthcare programs.
At the state level, we have state health departments,
Okay.
responsible for licensing healthcare personnel and facilities, monitoring diseases, and providing essential public health services.
And at the local level, we have county health departments and city public health offices,
Right.
offering a range of services,
Yes.
from immunizations and disease screenings to health education programs.
These agencies work together to create a safety net, ensuring that people have access to essential healthcare services regardless of their location or circumstances.
As you can see, the world of healthcare is incredibly diverse,
It is.
with a wide array of settings, services, and challenges.
And as future psychologists, you have the opportunity to make a real difference in people's lives.
Yeah.
Whether you're working in a hospital, a private practice, a community health center, or any other setting.
But no matter where your career takes you,
Yes.
remember the importance of lifelong learning, staying curious, and constantly seeking to expand your knowledge and skills.
The field of healthcare is constantly evolving, and to be truly effective, you need to embrace the journey of lifelong learning.
Okay, before we move on to part 2, let's pause for a moment and reflect. With all these healthcare systems and trends in play, what stands out to you?
Wow.
What sparks your curiosity? And how do you envision your role as a future psychologist within this complex and ever-changing landscape?
Something to think about.
We'll delve deeper into these questions in part 2.
Okay.
So stay tuned. Welcome back to our deep dive into healthcare systems.
Right.
We're not just skimming the surface here.
No, we're not.
We're going deep to help you prep for those psychology exams. AD understand what it really means to work in this field.
It's about connecting the dots.
Yeah.
And seeing how these trends and challenges will impact your future careers as psychologists.
Last time we took that whirlwind tour through the history of Western medicine, from ancient plagues to modern medical marvels.
We also uncovered some of the major forces shaping healthcare today, like specialization, the aging population, and those ever-rising costs.
Let's dive into a few more of these challenges, starting with one that's close to home.
Okay.
Mental health, it's finally getting the attention it deserves.
There's still a long way to go.
Yeah.
Stigma, limited access to care,
Right.
and inadequate insurance coverage remain major obstacles.
And we desperately need more mental health professionals,
We do.
especially in underserved communities. It's a critical need that you, as future psychologists, will be stepping up to address.
Absolutely. And it's not just about providing direct care. It's also about advocating for systemic change, for policies that support mental well-being
Right.
and make care more accessible and affordable.
Another challenge that's top of mind for everyone is infectious disease outbreaks.
Yeah.
We've all just experienced a global pandemic, so it's clear how quickly things can change.
What's fascinating is the constant evolution of infectious diseases. New viruses emerge.
Oh, yeah.
Bacteria develop resistance to antibiotics. It's a never-ending race to develop effective treatments and prevention strategies.
And this requires a global perspective, right?
Right.
It's not just about what's happening in one country. It's about collaboration and information sharing across borders.
Exactly. Infectious diseases don't respect geographical boundaries.
Right.
So international cooperation is essential to track outbreaks, coordinate responses, and ultimately protect global health.
Now let's shift gears to a challenge that might seem a bit less dramatic, but has huge implications. Medication adherence. Sounds simple enough, taking your medications as prescribed. That
The reality is that medication adherence is a major issue. Studies show that roughly 50% of patients don't take their medications correctly,
wow.
leading to poorer health outcomes, increased healthcare costs, and even preventable hospitalizations.
And this is where psychology plays a crucial role.
Yes.
Understanding the psychological factors that influence medication adherence is key to improving patient care.
It's about going beyond simply reminding people to take their pills.
Okay.
It's about addressing the underlying reasons for non-adherence, whether it's forgetfulness, side effects, concerns about the medication,
Right.
or even a lack of belief in the effectiveness of the treatment.
So it's about empowering patients to be active participants in their healthcare journey, right?
Exactly, helping them understand their conditions, the importance of medication adherence, and working collaboratively to develop strategies that fit their individual needs and lifestyles.
It's fascinating how seemingly small things like taking a pill can have such a big impact on a person's health. As a psychologist, you'll be in a unique position to help patients navigate these challenges and make informed decisions about their care.
Absolutely. Now let's shift our perspective and imagine ourselves as patients navigating this complex healthcare system.
Okay.
Let's say you need to see a specialist for a specific health concern.
Okay, so I'd probably start by talking to my primary care doctor,
Yeah.
who would then refer me to the specialist, right?
That's the typical process.
Okay.
But here's a potential snag. You might need pre-authorization from your insurance company
Pre-authorization.
before they'll agree to cover the specialist visit.
That sounds like a potential hurdle.
It can be. It basically means the insurance company wants to make sure the specialist visit is absolutely necessary before they'll greenlight it.
So more paperwork, more waiting, and potentially more frustration.
Unfortunately, yes. And this is where the financial burden of healthcare often becomes very real for people. Even if you have insurance.
Yeah.
You might face high deductibles, copays,
Okay.
and limits on what's covered.
And for those without insurance, it could be a nightmare scenario.
Absolutely. The cost of medical bills is a major cause of debt and even bankruptcy for many people. It's a sobering reminder of the need for systemic changes
Right.
to make healthcare more accessible and affordable.
Okay, so let's say I've made it through the pre-authorization process, seen the specialist, and now they're recommending a specific treatment. But what if my insurance company doesn't want to cover it?
That's another frustrating possibility, but it doesn't mean all hope is lost.
Okay.
You can appeal the insurance company's decision,
Okay.
although it can be a lengthy and often complicated process.
Gathering medical records, writing letters, potentially even going through a formal hearing. That sounds overwhelming, especially when you're already dealing with a health issue.
It can be, and this is where the patient-provider relationship becomes so crucial.
Yeah, a healthcare provider who's compassionate and knowledgeable can be a real advocate for their patients,
Exactly.
helping them navigate the system
Right.
and connecting them with resources to support them through this process.
Exactly. It's not just about medical expertise.
Yeah.
It's about being a partner in the patient's healthcare journey, understanding their unique circumstances, and providing support that goes beyond just addressing physical symptoms.
So it's about seeing the whole person, not just the illness.
Right. Absolutely. And that's something that psychologists are particularly skilled at. Now, let's imagine a scenario where someone needs ongoing care.
Yeah.
Perhaps for a chronic condition or after a surgery.
What kind of options are available for people in those situations?
Well, they might be referred to a rehabilitation facility or a skilled nursing facility. These settings offer a higher level of care and therapy than what's typically available at home.
But I imagine those facilities can be quite expensive.
They can be, and insurance coverage for long-term care is often limited, leaving many people to pay out of pocket,
Right.
which can quickly deplete their savings.
And what about those who don't have family or friends to help with care? I imagine that could be incredibly isolating.
That's a major concern, especially for older adults. Loneliness and social isolation can have a profound impact on both physical and mental health,
Yeah.
leading to a vicious cycle of decline.
It's like a domino effect. One problem creates another.
Exactly, and that's why a holistic approach to healthcare is so vital.
Yeah.
We need to consider not just the physical symptoms, but also the social, emotional, and psychological factors that influence a person's overall well-being.
Now let's address a difficult but important topic, end-of-life care, when someone is facing a terminal illness.
Hospice care is often the most compassionate and appropriate option.
Okay.
The focus shifts from aggressive treatment to providing comfort and support for the patient and their loved ones during the final stages of life.
And hospice care can be provided in a variety of settings, right?
That's right. It can be provided in the patient's home, in a specialized hospice facility, or even in a hospital. The goal is to create a peaceful and supportive environment where the patient's comfort and dignity are paramount.
It's about honoring the patient's wishes and ensuring their final days are filled with compassion and care.
Exactly. And while it can be challenging for healthcare professionals, working in hospice can also be incredibly rewarding.
Okay.
Knowing you're providing comfort and support during such a vulnerable time.
So we've explored various facets of the patient experience, highlighting the complexities and challenges of navigating the healthcare system.
And as future psychologists, it's essential to understand these complexities and to approach your patients with empathy, understanding, and a willingness to advocate for their needs.
Okay, let's zoom out a bit and consider some key takeaways from this deep dive so far. What are the overarching lessons we should be carrying with us?
First and foremost, it's crucial to recognize that the healthcare system is a vast and intricate web of interconnected parts. Hospitals, clinics, insurance companies, government agencies, and countless individuals all playing their roles.
And this system is constantly evolving. New technologies, treatments, and policies emerge all the time, making lifelong learning an absolute necessity for healthcare professionals.
We've also seen that healthcare isn't just about treating physical ailments.
Right.
It's about addressing the social, emotional, and psychological factors that impact a person's overall well-being.
And that's where psychology plays such a vital role.
Absolutely.
From helping people manage chronic conditions to advocating for improved mental health services, psychologists are essential members of the healthcare team.
Absolutely. And finally, we've gained a deeper understanding of how challenging it can be for patients to navigate this complex system. Paperwork, insurance, hurdles, financial burdens, and the emotional toll of illness. It's a lot to bear.
So as future psychologists, it's crucial to approach your patients with empathy, understanding, and a genuine willingness to be their advocate within this intricate system.
Remember, it's not just about medical knowledge. It's about recognizing the individual, their unique circumstances, and providing support that goes beyond just treating symptoms.
Okay, we've covered a lot of ground in part 2, what awaits us in the final part of our journey.
In part 3, we'll delve into the exciting possibilities of personalized medicine, explore the impact of technology on healthcare, and discuss the importance of ethical considerations in this rapidly evolving field. Stay tuned, it's going to be fascinating.
Welcome back, Deep Divers. We're in the final stretch of our exploration into healthcare systems, and I'm really excited about this part.
Me too. We've built a solid foundation, exploring history, unpacking challenges, and even stepping into the patient's shoes.
Right.
Now we're going to look ahead to the future of healthcare.
The future? That sounds exciting and maybe a little intimidating.
Yeah.
What does the future of healthcare even look like?
Well, one of the most promising developments is personalized medicine. It's about tailoring treatments to an individual's unique genetic makeup, lifestyle, and even their environment.
So it's like having a healthcare plan that's designed just for you, not just for your disease.
Exactly. Personalized medicine moves away from that one-size-fits-all approach and embraces the individual's unique needs and characteristics.
That sounds incredible, but how does it actually work?
Advancements in genomic research have allowed us to analyze DNA and identify specific genes that might influence a person's health.
So we're talking about predicting a person's risk for certain diseases.
Yes.
Choosing the most effective medications based on their genes, and maybe even preventing some conditions altogether.
You got it. For example, if someone has a family history of heart disease, personalized medicine could help identify their specific risk factors and create a preventive plan tailored to their individual needs.
Wow, it's like having a personalized roadmap for your health. Is this something that's available now, or is it still in the realm of science fiction?
It's becoming increasingly common, particularly in areas like cancer treatment and pharmacogenomics.
Pharmacogenomics.
Which is the study of how genes influence your response to different medications.
So instead of going through a trial and error process of trying different drugs,
Yeah.
we could use genetic testing to determine the most effective medication right from the start.
That's the idea. And it's not just about treating existing conditions.
Okay.
Personalized medicine also has the potential to revolutionize preventive care.
It's exciting to imagine a future where we can identify individuals at high risk for certain diseases and intervene early before symptoms even appear. It could dramatically change how we approach healthcare.
It could. And as this technology continues to advance and become more accessible, it's likely to have a profound impact, leading to more effective treatments, fewer side effects, and a shift toward proactive personalized care.
Okay, so personalized medicine is all about tailoring treatment to the individual. But what about the role of technology in shaping the future of healthcare in a broader sense?
Well, technology is already transforming healthcare in countless ways.
Right.
We've seen the rise of telemedicine, which allows patients to consult with their healthcare providers remotely, using video conferencing or phone calls.
Telemedicine has been a game changer, especially during the pandemic. It makes healthcare so much more accessible for people in rural areas, those with mobility issues, or anyone who faces barriers to in-person care.
Exactly. And it's not just about virtual visits. We're also seeing the increasing use of wearable devices,
like smartwatches and fitness trackers,
that track a wide range of health data, from heart rate and sleep patterns to activity levels and even blood sugar levels.
It's like having a personal health monitor on your wrist. But with all this data being collected, what happens to it? How is it used to improve healthcare?
That's where big data and artificial intelligence come into play. AI algorithms can analyze massive amounts of data, from wearable devices, electronic health records, and even genetic testing, to identify patterns and trends that humans might miss.
So we're talking about potentially earlier disease detection, more accurate diagnoses, and maybe even personalized treatment recommendations generated by AI.
Precisely. And AI can also help streamline healthcare processes.
Improve efficiency and reduce costs, for instance. AI-powered chatbots can answer basic patient questions, freeing up healthcare professionals to focus on more complex cases.
It sounds like AI has the potential to be a powerful tool in healthcare, but with any powerful tool, there are always ethical considerations.
You're absolutely right. We need to ensure that technology is used responsibly and ethically in healthcare, with a focus on patient privacy, data security, and equitable access to care.
It's about ensuring that these advancements benefit everyone, not just a select few, and that we use technology in a way that enhances, not replaces, the human connection in healthcare.
I couldn't agree more now as future psychologists.
Yeah.
You're entering a field at the forefront of these technological and ethical advancements.
That's kind of exciting.
So how can you prepare for this rapidly changing landscape?
Well, I think staying informed is crucial. Reading articles, attending conferences, and engaging in discussions about these advancements can help us stay up to date on the latest developments and the ethical dilemmas they might present. Absolutely, and be open to learning new skills. Technology is constantly evolving. So adaptability and a commitment to lifelong learning are essential.
I think it's also important to be aware of the potential psychological impact of technology on both patients and healthcare providers.
That's a great point. Think about the potential for increased anxiety or stress related to constant data monitoring or the challenges of maintaining patient privacy in a digital world. These are all areas where psychologists can contribute their expertise.
It seems like the role of psychology in healthcare is becoming even more important as we navigate these technological advancements and their implications for human behavior and well-being.
I agree. Psychologists bring a unique perspective to the healthcare team, focusing on the whole person, not just their physical symptoms.
Well, it feels like we've reached the summit of our healthcare exploration. We've journeyed through history, grappled with challenges, and glimpsed into the future.
And as you step into your careers, remember that you're not just entering a profession, you're becoming part of a movement to improve health and well-being.
It's about using your knowledge, skills, and compassion to make a positive impact on individuals and communities.
So as you continue your studies and embark on this incredible journey, keep asking questions. Stay curious and never stop learning. The future of healthcare is being shaped right now, and you have the potential to be a part of it.
That's a wrap on this deep dive into healthcare systems. We hope you've gleaned valuable insights to ace those exams and fuel your passion for making a difference in the world of healthcare. Until next time, keep exploring, keep learning, and keep diving deep.